Every now and then, it's good to hear from real people as opposed to experts. Peter Struwing joins me right now because he is a real person. He's an expert in building things, and you're a project manager, but you also have a lot of thoughts about government and governance. And let's just talk about healthcare for a while, because it's turning into a huge, huge problem in Canada when people are saying we just can't get healthcare for weeks and weeks.
No, absolutely not. And if you look at the lineouts to get into the hospital, you're looking at 7 to 8 hour waits.
So, well, what should be done about it? I mean, this is for healthcare for everybody.
Well, we have universal healthcare, and I work with a lot of U.S. gentlemen, and they think we have free healthcare. But if you seek healthcare in the U.S., you see a doctor almost immediately. You see the nurses almost immediately. They have someone running around.
Yeah, and then they're going to send you a bill for $500,000.
And that's why you have insurance.
So, I mean, so what do we have to do in Canada? Do we have to have two-tier healthcare?
I believe we already have two-tier healthcare. It's kind of hard to find, but we do have it. A lot of companies have benefits that have private doctors.
Yeah.
So it's already here.
So someone though who has not insurance or is not with a big company and they have a heart problem, they go to the hospital, they'll probably get cared for in a while.
Yeah,
but
correct.
It's not that fast.
Yeah, correct.
In many cases.
Correct.
So do we have to then incur bigger debts to have more health care in Canada, in Ontario?
I think that if someone can afford the insurance or the health care that's private, they should be more than allowed to seek it out.
What about managers? I hear this from health professionals all the time. They say, 50 years ago we had 3 administrators in a hospital, and now we have 300 administrators. Correct. And we're finding the hospitals are not as efficient as before. Do you think that somebody should just go in there and say, hey, you can't run this hospital. If you're not running it well, you're out? Should we have some accountability on that?
We need to make sure that all the tax dollars are going to first-hand care. So the doctor, the nurses, that's where all the money has to go to, the equipment. I mean, we have Lions clubs and everything else. They're out raising money all the time to buy a new x-ray machine or donate to the hospital, which is what the service clubs do. It's great.
Yeah, that's great.
But at the same time, do we need to have, I should say, 3, 4 administrators? No, we don't. The doctors know what they're doing, I hope.
Well, I mean, the doctors know what they're doing, but it's the people who are trying to run the doctors who may not know what they're doing.
Correct.
So, but what then? I know there's people now who are socialists who are saying, well, that's just wrong because we're going to have all the rich healthy and the poor are going to get unhealthy.
Correct. And they're probably the same ones looking for basic income.
I take it you're not for the basic income?
Not whatsoever. I believe someone should get out and then be working every day. If they have a reason, if they're on disability or something, and I understand that. But if you're fully capable of working, our country's built on people that actually want to get out and work.
Peter, thank you very much. 3 minutes. If you did not know that the red ensign, formerly Canada's flag, has now been labeled by the Canadian government a symbol of hate, and they're sending that to all the students, then press subscribe and PayPal and learn more.